Hi, this is Ryan Brown from mockquestions.com. In this video, we'll discuss 5 surgical first assistant interview questions from our website. We'll go over each question and some advice on how to answer them, along with an answer example. Afterwards, if you found this video helpful, please like and share. That would mean a lot to us. Okay, let's get started. Question number 1. Why did you choose a career as a surgical first assistant? Interviewers almost always ask what caused you to be interested in the career you've chosen. It gives them an opportunity to see how you feel about the work you are doing and what made it stand out among so many career choices as the right one for you. There's no right or wrong answer here. It's simply a way of opening the door to get to know you. Here's our answer example. When I was younger, I thought of becoming a surgeon. As time went on, I really didn't feel like I wanted to spend the number of years required to become a physician and then to specialize in surgery. For me, the next logical choice was to be a surgical assistant. I still get to be in the operating room and have a part in helping people be better, but I did not have to go to school for as many years as becoming a surgeon would have required. Question number 2. If you were scheduled to assist with a surgery, but had reason to believe that the surgeon was impaired and may be unsafe to perform surgery, what would you do? Unfortunately, scenarios like this do happen in real life. The interviewer is not trying to trick you into being the bad guy, but rather wants to know that you are able to prioritize your patient's health over the feelings of a surgeon who is possibly impaired. Patient safety should always be the first thought for any of us providing care. If I were to suspect that a surgeon is impaired in any way, I would immediately notify my supervisor with my concern. Even if it is found that the surgeon is well and can perform the surgery, it is always better to err on the side of caution when patient care is a factor. We are all responsible for protecting a patient's safety. Question number 3. What is an example of one of the most difficult cases you have ever worked? The interviewer understands that every surgery is not an elective procedure and may be a more difficult situation than others. When you are asked a question like this during an interview, it is not necessarily because the interviewer wants to hear a story of a difficult time, but more likely that he or she is trying to see how well you cope with difficult situations. As always, remember to protect patient confidentiality when giving an answer. The most difficult case I ever worked was the surgery of a 14-year-old boy who had been in an automobile accident. The driver of the car that hit him was drunk. The boy lost his leg and the other driver walked away with only a few cuts and bruises. It was a devastating event. Question number 4. What are some of the first things you'd like to accomplish if you are offered this position? The way you answer this question could be potentially hazardous if you aren't careful. Of course, you don't want to be a slacker and say that you want to know where the break room is and check what your days off are going to be. Also, going in the completely opposite direction by stating changes you intend to make within the department could be a bad move too. This is a time to focus on how you will fit into the company and department you are joining. So, the answer to this question should start with taking some time to learn culture and practices. At first, I'd really like to get to know the team I will be working with and find out how I can become an asset to them. I'm very interested to learn about the company as a whole and see if any of my past experience would be something that management would like to utilize as we work together to make the company the first choice for patients. Question number 5. Have you ever considered going back to school to get a higher degree or to change career paths? There are people who choose a career and later return to school. Some have the objective to get a higher degree in the same field or to change careers altogether. This question gives the interviewer an opportunity to know you and what your future plans may be. In turn, your answer allows the interviewer the chance to see where you may fit within the company now and in the future. If you have thoughts of continuing your education, don't be afraid to share that with the interviewer. Just remember to point out why you feel you would be an asset to the company now. I have considered going back to college a few times, but at this point in my life, surgical assisting is my passion. I feel I am already in an industry that is important and growing, I feel like if I were to take any additional classes, I would want them to be something that would add value to the education and experience I have now. Thank you for watching. If you found this video helpful, it'd be greatly appreciated if you could subscribe to our channel. It really does help motivate us to continue creating videos. Thanks again, and we hope you stick around to watch more interview practice videos from Mock Questions.